Is it the quiz for chapters 10 and 11?
No, it should
It's
be
7 through
the
9?
7 through 9. We'll do 10, 11 Thursday.
Okay.
Okay, so the word is all lowercase, venipuncture.
Could you possibly spell that for me? It's not.
Yes, VENIPUNCTURE.
Thank you.
Did it work?
Yeah, it did.
Okay, thank you guys.
Did you say when we were done that we could click off, or you want us to stay on here?
Stay on. Okay, everybody done? Yes? Okay. All right. All right, here we go. So let's just quickly go over the quiz real quick just to make sure we. Okay. Everybody yell out the answers and let's make sure. Oops, did we lose somebody? We lost Sam. Hold on. You back with us, Sam?
Yeah.
Okay. All right, guys. So let's go over the answers real quick. You guys give me the answers, just so that we know if we've missed anything. All right. What was another term for white blood cells? Anybody remember?
Leukocytes.
Okay. What was the purpose of the tourniquet?
Decrease venous flow.
Exactly. Tourniquet should be placed how many inches above the site that you're going to draw from?
3 to 4.
Good. When should you remove the tourniquet be removed from the arm? Does anybody remember?
Before you remove the needle.
Okay. What is the most common antiseptic used in routine venipunctures?
Could you repeat that?
What is the most common antiseptic used in routine venipunctures?
The iso, whatever, alcohol.
Yeah,
Yep.
that.
Yeah, that one. That's a good one, right? Which carries and transports hemoglobin?
Red blood cells.
Good. At what angle should you do a venipuncture needle?
15 to 30.
Yep. What vein is the first of choice when we're doing a venipuncture?
Median cubital.
Yep. During the venipuncture, the tourniquet should stay on no longer than,
A minute.
right? A PCT has completed a blood draw. What should the PCT include on the label?
Identification.
Yep. Okay, so which one of those were not an anticoagulant? Polymer gel, sodium heparin, sodium citrate, or EDTA?
Polymer gel.
Right. All right, can anybody remember the order of the draw?
The first one's yellow, I think.
Okay,
Light
Blue.
right?
what was that? I'm sorry, I didn't hear you.
I think it's yellow, light blue. And I forget the rest.
Okay, yellow, light blue. What's the-
Red.
Red.
Yeah.
What's the next one? So after red,
The gold like one.
gold one,
Green.
green,
Lavender and gray.
good, awesome. All right, and how many times may a needle be used before you discard it?
Once.
Okay, and I always send this one to Sam. The smaller the gauge, the number, the,
Larger the diameter.
right. All right, which color-coded tube does not contain any additives?
Is the glass one.
Yep, the red glass one.
Yeah, the red glass.
Yep. Which of the following indicates the largest size needle? 16 or 23?
16.
16. All right. And we talked about an inherited disease that causes decreased blood clotting. Does anybody remember what that was?
Hemophilia.
Yep. And why should a PCT keep the specimen container in a vertical position when you're transporting?
Prevent I think it's pronounced hemolysis.
Yep. So it prevents it. Okay. So let's move on. All right. First of all, what did you guys get to do on Friday? In clinical?
Sorry, I was chewing. We learned how to tie a tourniquet.
Awesome.
We stuck a fake arm with a butterfly needle.
Okay.
What else did we do? I don't remember.
How did that feel? Did you guys feel like you kind of got it when you did the stick?
Yeah, I think I did.
Okay. Did you review some past stuff also? I'm just kind of curious where we're at.
Mm,
Or did you
I think
focus
we-
on phlebotomy?
Yeah, I think we reviewed stuff from last semester, and then around noon we did phlebotomy.
Okay. All right. All right. So today we're going to talk about capillary collection. So this is a little bit different. Let's go there. Okay. So most often we are doing venipunctures. Okay, that's the most common way to obtain a blood sample. But at times we have to do a capillary. So it is preferred method for newborns and infants to do like a neonatal bilirubin and some other newborn screenings and point of care testing. Okay. Capillary collection is also used for the ancillary blood glucose testing. Children under 2. So some reasons that we do capillary would be children under 2, geriatric patients, obese patients, those that are at risk with deep venous punctures, those only needing a dermal puncture, patients who require frequent blood tests and glucose monitoring. You wouldn't want to be sticking them all the time, so we do a capillary. And patients with burns and scars, okay? Capillary collection, if you want to look at that in your book, it's going to be in box 10.1. So if you want to look a little bit more. It's a really good route for adult patients undergoing frequent blood glucoses, okay? The test requires just a teeny bit of blood, and it has to be done frequently. So it is the preferred access. Now, capillaries have kind of a mixture of blood because capillaries are like a bridge between the arteries and the veins. So there's a mixture of venous blood and arterial blood in that sample. I just wanted to kind of tell you guys that the bridge. The reason we do it with folks who have burns or scars, because those sites are at risk for venous thrombosis, and it caused when clots form within the veins. So we do the capillary on those patients. Other patients may be at risk for serious complications with deep venous puncture, including somebody with introgenic anemia, hemorrhaging, infection, organ and tissue damage, cardiac arrest, things like that, okay? This word here, this introgenic anemia, is actually caused by excessive blood draws. Again, it is the preferred method in infants. We can't, because of their body size, we have to be careful of how much blood we actually take out of their system. And we'll talk about that in a minute. So it is the preferred method of collection for newborns, infants, and children under 2. They have smaller veins and low blood volume. So again, if we have to constantly be doing blood draws on them, it could be potentially dangerous for them to take a certain amount of blood out of their bodies. Some tests cannot be performed with a capillary collection, so we have to know those also. These include blood cultures and routine coagulation tests. All right, here's our first question. Good candidates for dermal collection include patients who? What do you guys think? I gave you some reasons why. What do you think?
The D.
It is D. Let's make sure I'm right. Yep. So yes, somebody who's got frequent collections, obese, and severely dehydrated, you're not going to find a vein on those folks. Okay. Another question, capillary collection may be appropriate in geriatric patients because, what do you think? Anybody?
B.
B, because their veins tend to be small and fragile. Absolutely. Okay. A capillary puncture collects blood from the capillaries, like I said. So remember, it's the bridge between the veins and the arteries. It has a mixture of blood. The arterial portion in the sample is increased when the collection site is warmed and may be done to help increase blood flow before collection. So what that means is, well, let's talk about this here and I'll talk about that in a minute. If the patient needs repeated potassium levels, calcium levels, total protein, hemoglobin, or glucose, you must use the same collection technique each time, okay? Automatic puncture devices deliver a swift puncture to a predetermined depth, which can be significant advantage at sites where the bone is close to the skin. So we have an automatic puncture device that we use. Micro collection tubes are made of plastic and are available with a variety of anticoagulants and additives. Capillary tubes are available in plastic and again come in a range of sizes. They're available in plain, blue band, or heparin coated with red, yellow, or green bands. And microhemocratic tubes are small plastic tubes, and they can have a volume up to 75. They're not used very much though. Okay, so let's talk about that warming device. Warming devices, they actually help increase the circulation. Things like simple towels or washcloths can be soaked in warm water and applied to that site. There's also commercial warming packs that are available in facilities, so it kind of depends on what the facility has. The temperature of the device should not exceed 42 degrees centigrade, and it should be applied for 3 to 5 minutes, okay? 3 to 5 minutes. All right. All right, so what was it? An infant heel warming device should be applied for how long, guys? Anybody?
To D.
Should be 3 to 5, I believe. 3 to 5 minutes. A warming device should be applied for 3 to 5 minutes. Okay. Okay, so we want to do these capillary collections on warm, healthy skin that's isn't full of scars, cuts, or bruises or rashes. Okay. Bone punctures can lead to osteochondritis, which is a painful inflammation of the bone or cartilage, or osteomyelitis, which is a serious bone infection. So we want to make sure we're not going to hit bones. So we want to find a nice, warm, healthy piece of skin without scars or any kind of rash. Okay. The puncture depth and width to minimize the risk of inflammation and infection. The lancet should never penetrate more than 3 millimeters. Okay, 3 millimeters. For a heel puncture, the maximum depth is 2 millimeters. That's because that heel bone lies right underneath the surface, okay? And for premature babies, the recommended depth is 0.65 to 0.85 millimeters. The puncture width should not exceed 2.4 millimeters. So we don't want to go more than 3 for the general public. Heel punctures should not be more than 2.0, and little tiny babies should not be more than 0.65 to 0.85. And the width should not exceed 2.4. And these are all millimeters. All right, so the depth of a heel puncture should not be more than, let's see if you guys remember, somebody yell it out.
A.
Should not be more than A, that's right, 3. Oh, 2. Remember, it's a heel. I'm sorry, it's a heel we're talking about. So a heel puncture should not be more than 2 because it's right over that bone. Capillary collection sites for adults and older children. The best site is the palmar surface of the distal segment of the 3rd, middle, and the 4th ring finger. Okay, so you're going to see this a lot on your quizzes and exams, and then especially your certification. So let's make sure we know this one. So the best site is the palmar surface of the distal segments of the 3rd, so which is the middle finger, and the 4th finger, which is your ring finger. Okay, those are the 2 preferred fingers. Now, if a child is younger than 1 year old, they don't really have enough area on the fingers to do a finger stick. So the best place to do that would be on their heels also. Okay. So we would do that with children under 1. That's 3rd and 4th. Okay. Capillary collection sites for infants again. Again, if they're 1 and under, we're going to do the dermal on the heel, on the medial or lateral borders of the plantar surface. So what that means is on the inside of the heel or the outside of the heel, not in the center of the heel. Okay. Medial, inside, lateral. All right. Where should we do the fingers? Anybody? Which one of these are right?
C.
C. Yes, the 4th ring. And does anybody remember what the other one was?
The middle finger.
The middle finger. Okay. What is the location for heel sticks?
B.
B. Very good. All right. So steps to collect. Again, you're going to document requisition, sanitize your hands, and put on your gloves. Okay. Now, I do have to say that the only incident we really ever had with one of our students during their clinicals is they felt that they did not need to wear gloves when they did somebody's AccuCheck. Please, please, please. I know I've probably already said this before, but please wear gloves. Okay. It is one way to put your name on the blacklist of the hospital if you don't wear your gloves when you do an AccuCheck. Okay. All right. So then you're going to assemble your equipment. You're going to select and clean that site that you're going for, position and hold the area, make the puncture, dispose of that blade properly, prepare to collect the sample, and complete the procedure. All right. So after documenting on the requisition that you are performing a capillary collection, again, we're going to break it down a little bit more. You're going to sanitize your hands and put on your gloves. Again, you're going to select your equipment. You're going to select the area you want to do it, clean the site. Now, this is where it's a little different. You're going to warm the area first, if it's necessary. And then if the site feels cold, it should be warmed for at least 3 minutes at that temperature that's no greater than 42 degrees Celsius. You're going to use 70% of that alcohol to clean that site, okay? So again, we're still using the alcohol. And then this is for, again, just a little bit more. We're talking about finger or heel. This is just a little bit more breakdown. Again, let's talk about you're going to hold the finger or the heel firmly, grasp the patient's finger with its palmar surface up, holding it between your thumb and your index finger. Hold the patient's heel, place your thumb in an arch and wrap your hand over the top of the foot and place your index finger behind the heel. We're going to puncture the skin slightly lateral to the center of the finger, okay? That is slightly towards the pinky finger so that the hand can be tilted for easier blood flow into your container. If you're not able to get the blood with the first puncture, the policy at most institutions is to attempt one more puncture, okay? Make the puncture and dispose of the blade. Align the devices so that the cut is made across the fingerprint ridges or heel lines, okay? So align the device so that it cuts made across those fingerprints. Dispose of the blade immediately in your collection container. You're going to now here we go with this. You're going to wipe away the first drop of blood with a clean gauze to prevent contaminating the sample with the tissue fluid, okay? Keep the finger in a downward position to help encourage that blood flow. You can alternate applying and releasing firm pressure to increase the flow, but you're going to avoid a constant massaging of that area, okay? This can introduce tissue fluid back into your sample, which we don't want to do. Once the blood is flowing freely, position the container for your collection. All right, some precautions when you're collecting capillary blood. Micro collection tubes should be slanted downward, okay? You're going to tap the container lightly to move the blood kind of downward. Be careful not to overfill the micro collection tube containing that anticoagulant. Here's the order of the draw in collecting the capillary blood. Platelet counts first, so you might want to make note of these. Platelet counts, then CBCs, and then other hematology tests are collected first. Then you do any kind of chemistry tests. Okay, so your very first ones are platelet counts, CBCs, and hematology. Then we follow up with the chemistry. All right, so which samples is or are collected first in a capillary collection?
A.
Let's see. Kind of a trick question, just as a hint.
Is it E?
It is E. Yeah, it's a little tricky, isn't it? So your very first collection, it's platelet counts and CBCs. Then you're going to follow up with the chemistry. So yeah, it would be A and B only. Complete the procedure. You're going to apply pressure to the puncture site using a clean gauze. Once the bleeding has stopped, you can bandage the site for older children and adults. You don't really want to put a Band-Aid on an infant because they like to put everything in their mouths and they could choke on a Band-Aid. Okay, so we have to be careful of that. Label the microsample container and place it in a larger holder for transport to the laboratory. And then remember, you're always going to thank the patient for letting you do that. All right, bleeding time. So the bleeding time is in your book on page 170. I don't know if you have your books with you. If you do, you might want to look at it really quick while we're doing this. So a bleeding time test measures the length of time required for bleeding to stop after an incision is made. So we want to know if if your body cannot stop bleeding, okay, more or less. To perform a bleeding time, An automated incision device is used with the depth of set at 1 millimeter and a length of 5 millimeters. Okay. Now, normal bleeding time is 2 to 10 minutes and depends somewhat on the device that's used. What we're looking for, bleeding times that do not stop within 15 to 20 minutes means one of two things. Either the patient has some kind of a condition that's interfering with blood clotting, which would be, normal platelet plug formation, or the test was performed incorrectly. A capillary was scratched, the incision was too deep, the filter paper touched the incision site, or some kind of technical error was made, okay? There's also medications that can interfere with the blood bleeding time, such as like Tylenol, aspirin, ibuprofen, things like that, okay? So if you look on your page 170, it's got it. I can tell, I'm going to go through these, but you can see what you're doing as far as how to perform these. All right, so you're going to, of course, assemble your equipment. You're going to prepare the patient, position the arm, select your site and clean the site like usual. Then you're going to put a blood pressure cuff on, and you're going to keep it at about 40 mm's, okay? So you're going to pump it up to 40, and you're going to keep it there. Then you're going to position the device that you're going to use for the incision, which looks to be, if you're looking in your book, number 5. So you can see that little kind of lancet thing. Okay, so it's got a blade in it, and it's going to be placed perpendicular to the antecubital crease. Okay, so if I don't know if you were looking, but you can see it there. All right. Then you're going to make the incision and you're going to start timing. If you see that sheet of paper they're showing you, there's a wicking device. So there's a piece of paper that's a wicking, kind of almost like a cylinder kind of thing. And you're going to wick the blood away every 30 seconds. It's a filter kind of paper. Use the filter paper to absorb the blood from the cut without touching the incision. You're going to touch the edge of the filter paper to the surface of the blood drop without touching the skin or the incision. So you're essentially kind of tapping at the top of the little blood drop that's coming out, okay? You're going to wick. You're going to keep doing this process until the drop disappears. If 2 incisions are made, follow the procedure for each incision, okay? You're going to complete that test, and when there is no longer any blood, that means that the bleeding has stopped, and that's the time you're going to record from the beginning, okay? And then you're going to remove that blood pressure cuff, and then, of course, attend to the patient, with putting a Band-Aid on. All right. With this bleeding time test, which of these medications interferes with clotting, actually? Anybody know?
B.
All right, we've got a B. Anybody else? All right.
D.
Did you say C or D?
I said D.
Okay, I think you're right. So all of these are going to interfere with blood clotting, okay? Aspirin definitely interferes with blood clotting. It thins your blood. Ibuprofen has a tendency to do that, and so does salicylate. All of those. Okay. Whoop. All right. So what are we going to pump that blood pressure cuff up to and keep it up until we're finished with the procedure?
Is it D?
It is D, yes. Okay, so now what I want to do real quick is go to the end of that chapter in your book, and let's do the questions really quick. I want everybody to take turns on that, please. Let's go to number 1. See if you can remember what the answers are. Any ideas?
This is chapter 11, right?
This is chapter 10.
10.
Yeah, yeah. So what it's asking, if you don't have your book with you, it's asking you capillary collections are performed on what?
Capillary?
Capillaries. Very good. Yeah. Okay. Which of the following has a higher value in capillary sample as opposed to a venous serum sample? I'm going to give you that one. That one is hemoglobin. Okay. Tell me number 3, who are good candidates for this?
All of the above.
All the above. Very good. All right. Capillary collections may be appropriate in geriatric patients because
Their veins tend to be small and fragile.
right. Okay. An infant heel warming device should be applied for how long, guys?
3 to 5 minutes.
3 to 5 minutes. Yep. How deep should a heel, remember a heel puncture, how deep should it be?
B.
Yep. 2. Okay. Which finger is most widely used for capillary collection?
The ring finger.
The ring finger, so C. In performing a dermal puncture, the puncture should be, see if you guys remember that.
C.
You say C?
Yeah.
Okay, it is actually B. So you've got these little rings on your fingers, you know, you want them perpendicular to them. So you don't want to cut across the lines. You want to kind of go in the flow of the lines. So perpendicular. The location for a heel stick is?
B.
Yes, the medial and the lateral borders, not right in the center, okay? And not too deep so that we hit the bone. Which sample is collected first in a capillary collection? We just did that one, so what do you think?
E.
E, yep, A and B. Which medications again interfere?
All of them.
All of them. All right, what are we gonna pump that blood pressure cuff up to?
Forty.
40. And how frequently are we going to take that piece of wicking paper and wick that blood droplet?
Every 30 seconds.
Every 30 seconds, correct. Okay, let's move on to chapter 11. So we're going to talk a little bit about complications and some variables that could happen when we're collecting. Phlebotomists is the most responsible for blood draws. Specimen collection accounts for more than half of the errors in the variables. So if something goes wrong with the sample, it's usually something that's happened in the collection process, okay? And the analytical variables, that means the test itself can be affected by the pre-analytical variables, so things that are happening before it gets to the lab. Usually it arises during patient preparation and the collection. One of the most important day-to-day and hour-to-hour fluctuations is the composition of the blood, okay? To minimize the day-to-day and hour-to-hour fluctuations in the blood, we want to make sure that we're testing on a patient who is in a basal state. So, we need to indicate if the patient is fevered or other things like that. Are they fasting and not fasting, that kind of stuff. Okay, so here's some variables. This is what could alter your beautiful lab result. You had a great stick, you collected the blood, it gets to the lab, and it's all screwed up. What happened? Well, the person's age, was the person drinking alcohol, the altitude. So if you go out to Colorado, your lab results might be different than when you're in West Virginia, just because of the altitude. Was the person dehydrated? Diurnal variation? Did the person just exercise? This has happened to me before. I've just done a hard whatever run or whatever, and then I go get blood and they're like, what is wrong with you? Fasting. So was this person fasting or not fasting? Believe it or not, the patient's sex, medications, or medical treatments can alter the results, posture, pregnancy, and obesity. Okay. So locating that person. Let's say you've got a stat and you can't find the patient. Okay. So if the patient's not in the room, make every effort to locate that patient by checking at the nursing station. Maybe the patient was taken down to x-ray. Okay. If the patient is in another department and you have that stat test or some kind of timed request, proceed to that area and draw the blood. So you're going to go down to x-ray and you're going to draw that blood if it's a stat or a timed. Okay. If a stat test is ordered and your patient's not in the room, what should you do?
C.
C. Locate the patient and draw in that location. Okay. Identifying the patient. Several situations can make identifications difficult. Emergency requisitions, emergency room collections, orders telephoned into the lab, or requisitions picked up at the site. So deposit the difficulty, these situations are, despite the difficulty that you might encounter, the information on the requisition form must match exactly to the information on the patient's ID, okay? Any discrepancies should be resolved before you collect that lab. So if you see something on there and it's not quite right, we need to get it fixed before we draw, okay? Okay, so you come in and somebody's sleeping and you got to draw the blood. So if you encounter a sleeping patient, you should make 1 or 2 attempts to gently wake them up and then give them time to become oriented because they might come up swinging before you begin to draw. So they need to understand what you're doing, okay? There are times when you must draw on patients that are unconscious and they can't be woken up, and that's going to happen. Unconscious patients are most commonly encountered in ICU, emergency departments, and nursing homes, but you will encounter that. Presence of a physician or clergy. So you walk in the room and let's say the physician's in there. Return at another time for the procedure unless it is a stat or time collection. At that time, you would respectively interrupt and explain that this is a stat draw and you have to take it. So, let's say the person's minister's in there and they're kind of having a prayer session or something, and it is a stat, then you can explain kindly what's happening and ask them to maybe leave the room or, if they're comfortable with staying in the room, that's fine, but you need to explain what you're doing. If the physician enters while you're preparing to draw, leave the room until he or she is finished with the patient, okay? They're usually not in there very long, guys. Now, if there's visitors in the room, greet them as you would the patient, explain the purpose of your visit, and ask the visitors if they wouldn't mind stepping out. Most visitors probably want to step out while you do the work, okay? You've got a patient who's apprehensive. Many patients, maybe they've never had blood drawn, or they've heard horror stories about having blood drawn, or maybe they had a bad experience. Um, so you can easily calm them down by engaging them, in conversation on weather, traffic, their cat that's on their desk, whatever. Language problems, when the patient cannot understand you, he or she cannot give informed consent. So if they are, let's say, confused, they're not going to be able to give you informed consent. You may also need a translator for somebody who may not speak the language. Alternative, you can effectively communicate with the patient by showing him or her what you're doing, like showing them that you're going to be doing blood draws and etc. All right, so this patient's not wanting this, is refusing, okay? The patient always retains the right to refuse, remember. So you're going to find the nurse, you're going to explain to her that the patient has refused the procedure. The nurse may ask you to return with him or her to the room. So they might have, since they're on the floor all the time, they might have a little bit more rapport with the patient and may be able to explain things a little bit more or get them to understand why they need this lab work done, okay? Again, if the patient refuses, you're going to document this on the request along with the nurse's name and notify the healthcare provider. Most often, the nurse will be the one notifying the healthcare provider, but it depends on your facility. Occluded or sclerosed veins. So there's veins that could be blocked or are hardened. They feel hard. They feel real like a cord-like. They can be caused by inflammation, disease, chemotherapy, prolonged IV therapy, or continuous venipunctures, okay? Such veins are susceptible to infection and the blood flow is impaired, so the sample may produce test results that are not appropriate, okay? So we have to try to stay away from those kind of veins, okay? A hematoma. A hematoma may be caused by the needle going through the vein. I've had that happen before. Or by having the bevel opening only partially in the vein. So you get the needle into the vein, you got it in, but it's not all, the bevel's not all the way in. So part of it's in and part of it's out. So the blood's leaking out into the tissue, okay? Or by failing to apply enough pressure after withdrawal. So you got busy, you're over here doing your thing, and you didn't really have either the patient hold pressure on it or you hold pressure on it, and then we've got a hematoma starting, okay? Blood from a hematoma is no longer fresh from the vein, and the hematoma can obstruct the vein, slowing the blood flow. We might have swollen tissue or edematous tissue because of accumulation of tissue fluid, maybe like somebody who has had a mastectomy or something or has lymphedema. Also, burns, scars, and tattoos have impaired circulation. They can get infected easy and are much more painful if you're doing an venipuncture through that. All right, so I kind of mentioned mastectomies. The mastectomies usually include the removal of lymph tissue on that side. So there's no fluid movement. The collection also may be painful to that patient and the risk of infection is increased on that side. You also want to avoid IV sites. Blood should not be drawn from an arm if there's an IV device in that place. So use the other arm instead or another alternative site if you can. All right, so we also want to check out any condition resulting in disruption of skin integrity. So things like open lesions, rashes, tattoos, maybe something that's not healed all the way from, I had stitches and it's not healed all the way. These are places we probably don't want to be drawing from. This also has a risk of infection. Okay. All right, let's answer this question for me. What condition may alter the quality of a specimen or cause harm to the patient during a blood draw?
All of them?
All of them, absolutely. So, swollen tissue, mastectomies, hematomas, all of those. Okay, so difficulty in finding a vein. So you're in one arm and you've got your tourniquet on and you're looking around and boy, you're not seeing anything. What are you going to do? So take the tourniquet off. Let's look in the other arm, number one. Okay. You might try to enhance the vein prominence by massaging gently upward from the wrist to the elbow. Dangle the arm in a downward position to increase the blood in the arm. Applying heat helps. Rotate the wrist to increase the prominence of the cephalic vein. So these are all little tricks. And as you get into it and you get into those phlebotomists that have been phlebotomists forever, I'm sure they have all sorts of other little tricks to share with you. All right, what can we do to enhance the vein prominence? Anybody?
B.
All right. It's actually C, I believe. Yeah, C. So we wouldn't want to elevate the arm. We want to actually put it in downward position. Yeah, that one doesn't seem to work very well. Squeeze the patient's wrist would help with a cephalic. So, and we would not apply ice. We would actually apply heat. So it would be squeeze the patient's wrist. Okay. Now here's a way that some people use if they definitely can't get any blood out of it or any vein, is they will actually put a blood pressure cuff on about 3 to 4 inches above where you want to draw and inflate the pressure above the diastolic but below the systolic reading. Okay, this helps. So this would be, instead of your tourniquet, you would use the blood pressure cuff. Hopefully you'll never have to do this. This increases the chance of infection and blood clots. So, but alternative sites might be the leg or the foot. They're not recommended sites for patients with diabetes for sure, or anybody on anticoagulant therapy. Collection from the leg and the foot requires a physician's written permission. So I'm not sure that you'll ever really see that. And you would use a winged infusion set on the back of the hand. Now the back of the hand does get used. And I have to tell you, if you haven't had it yet, that is more painful than in the arm. So if we can avoid it, we do. But if we can't, we go there next. Okay. All right, again, there's the cleaning of the sites. We can use the alcohol, methylene, and ethyl alcohol, or a tincture of iodine. None of these can be used for an alcohol test. Okay, so if we're going to do a blood alcohol, we cannot use anything with alcohol in it. All right, we cannot also use the tincture of iodine. These will all contaminate the blood, causing a false positive. So the person may not have been drinking, but it'll come up that he has, okay? Or vice versa. So what we are going to use is this povidone iodine or a benzyl, let's just say it's BZLK, okay, chloride. Uses it instead, except for patients under 2, then we don't do that. And hopefully we're not doing a blood alcohol on patients under 2. When you do use an alternative cleaning agent, you will have to document which one you used also, okay, on your requisition form. All right, so what are we going to, let's see, what antiseptic must be used when we're collecting a blood alcohol test?
Is it D?
Did you say D?
Yeah.
It's actually, yes, that's one of the answers. It's also this povidone iodine. So it's povidone iodine and the BZLK. Okay, none of these alcohols. So it would be actually F, C, and D. Okay, so povidone iodine and BZLK are used for blood alcohol tests. All right, we're going to talk about hemoconcentration, problems associated with tourniquet application. Okay, so this hemoconcentration is caused by the tourniquet that's on longer than a minute, over pumping of the fist, if you're doing sclerosed or occluded veins, somebody with long-term IV therapy or dehydration, okay? You get formation of petechiae, the tourniquet is applied too tightly, or latex allergy. So these can all cause issues with the tourniquet application, okay? So what can cause hemoconcentration? Does anybody remember? So one thing is something with the tourniquet, leaving that tourniquet on more than a minute, okay? So remember that, leaving the tourniquet on more than a minute, pumping the fist, okay? Sclerosed or occluded veins, and long-term IV therapy or even dehydration. These can all cause hemoconcentration, okay? Okay. We just did that, so we will do that. All right. Now we're going to talk about the winged infusion set. So that's something you guys actually practiced the other day, right? The butterfly, a little bit? Okay. So you assemble your equipment like usual, position the patient's hand, apply the tourniquet. You're going to insert the needle bevel side up in the direction of the vein, angled at 10 to 15 for a winged, 10 to 15. Collect the sample, finish the collection, and attend to that patient. You're going to dispose of that winged infusion set. So remember that the angle of the winged infusion set is 10 to 15 degrees. Okay, so things that can happen to the patient during the blood draw, syncope. So it's the medical term for fainting. So people can faint. They get nervous, they get themselves worked up. And then a lot of times people will get themselves really, really worked up. And then when you actually draw and it doesn't really hurt, all of a sudden they just kind of let go. And that's when they get really fainty. You think they're feeling great, you know, because, oh, they're not nervous anymore. And all of a sudden you look over and they're whiter than a ghost. Okay. So you want to look at the patient also when you're drawing. Don't just stare at the site. You need to look to see if the patient starts to their skin starts to feel cold and damp and clammy. They may have some beads of sweat on their forehead or their upper lip. They may start saying, you know, I'm not feeling so well. They may stop talking altogether, and they start kind of staring out. Their eyes start rolling back or whatever. Their head could tilt either forward or back. So you got to kind of watch your patient. It's more common with people who are in outpatient setting because inpatient, they're lying down in bed and they're less likely to be fainty. When a patient is dizzy, you're going to provide support to protect the patient. You're going to remove that tourniquet and stop that procedure, okay? You're going to apply a cold compress to the patient's head. That does help. If necessary, have the patient place their head between their knees. A lot of times when you are like in an outpatient setting, they'll get a fan out and start putting it on you. And they also kind of lie you back with your feet elevated. All right. Here's a question. You're collecting a specimen. The patient says, I feel lightheaded. What should you do? What do you think is the most important right now?
A.
Yep. We don't want that patient falling. All right. What are some symptoms of a patient that might be ready to faint?
B.
B, very good. Cool, clammy, and damp. They wouldn't be cyanotic. They would actually be pale and white. I don't know why they would be covered with petechiae. And yeah, so it's cool, clammy, and damp. Okay. Seizures. If a patient has a seizure during the procedure, remove the tourniquet and needle immediately and apply pressure to the site. If somebody has nausea and vomiting, when they're done vomiting, reassure the patient and make him or her comfortable. It's common for a patient to experience nausea. If the patient's MPO, do not allow fluids or food intake. Encourage the patient to take deep and slow breaths. All right, so if the patient is MPO and the patient says, I feel nauseous, what should you do?
A.
They're feeling nauseous, not faint.
D.
Yes. Encourage the patient to take deep, slow breaths. A lot of times that will make the nauseous go away. All right. Pain. So to prevent the startle reflex, make sure you warn the patient before the needle sticks. So say, you might say something like there's going to be a little pinch, or a little poke, or a little sting. A lot of people associate bee sting, so that they might know that word. Hematoma, when blood oozes from the vein into the surrounding tissues, a hematoma again is formed. We talked about that. If this occurs during the procedure, remove that tourniquet and needle immediately and apply pressure to the site. Lack of blood flow, so this can be caused by a defective tube. Did you check that expiration date? A lot of times, remember, if they are expired, the suction part of it the vacuum part is no longer working. If the needle is not properly inserted, or if you actually miss the vein. Sometimes veins can roll and move on you, okay? Happens to all of us. Defective evacuated tubes, like I said, if they're defective, the blood won't flow into because the vacuum is not working in the tube. Again, it could be because of a defect, expired tube, or a fine crack that you might not even see. And the improper positioning, if the tube is not the problem, the needle may be not properly placed into the vein, and you may need to just kind of readjust it. If the tube is too large for the vein, causing excessive vacuum to pull the vein onto the bevel, so it's too much, and it's actually pulling that vein right up against that bevel, so blood can't come through. A collapsed vein is caused by too much vacuum on a small vein again, or too large of a needle for that vein, or you pulled the plunger too quickly backwards. When you're using the tube system, a collapsed vein becomes evident when the tube is pushed onto the inner needle, okay? Veins that roll excessively, try to anchor them a little bit more with that free hand. Okay. Puncture of the artery. Puncture of the artery produces bright red blood and may cause spurting or pulsing of the blood into the tube. Okay. Failure to collect on the first try. The policy at most institutions is they do say that you can do a second try. A new needle and tube must be used. For second tries, go below the previous site or use the other arm. Okay. If unsuccessful, don't keep poking them. Get another phlebotomist to help. Okay. How many attempts can you usually do for venipuncture? What do you think?
The D.
Yes, 2. Good. All right. Patient's request. Sometimes a patient may ask you for water or change in bed position. Prolonged bleeding. So normally the site should stop bleeding within 5 minutes. In all cases, you must continue to apply pressure until all the bleeding is stopped. So just because you're in a hurry and you've got 100 other people to draw from, you make sure that that blood has stopped, okay? You're going to inform the nurse if the patient has a prolonged bleeding time also. All right, that's all of those. Let's see what we got here. That's interesting. All right, let me just make sure. I don't think I have. I'm going to go ahead and do these. I don't think I have slides on, so we'll just talk a little bit. Let me just check here. That's interesting. I think that we're going to do a new share here. We're going to go off to the Evolve account here. If I can find it. All right, let's go on to our Evolve here. Let's see if this is still open. All right.
Capillary collection equipment. Equipment needed is as follows. Skin puncture devices allow the phlebotomist to puncture the skin safely and collect the sample quickly and efficiently with minimal patient discomfort. For children younger than 1 year, the round heel puncture device should be used. This is a single-use device. The phlebotomist presses the device against the skin, depresses the trigger, and the needle automatically retracts. The contact-activated lancet device, also intended for single use, delivers a swift puncture to a predetermined depth, after which the blade automatically retracts and the device locks to prevent repeated use. Pink and blue color coding is used to indicate lancet width and depth, which affects blood flow. Always follow manufacturer recommendations for handling and use. Dermal puncture specimens are typically collected through the top of a microcollection tube or a capillary tube. Microcollection tubes are generally made of plastic and may contain a variety of anticoagulants or additives, which are indicated by a color coding system that matches that used for evacuated collection tubes. Some microcollection tubes are available with a plastic capillary tube that attaches to the microcontainer, allowing them to be filled by capillary blood to the predetermined fill line. Others have a small scoop on the lip of the opening to permit easy collection of each well-rounded drop of blood as it forms at the puncture site. Capillary tubes, also called microhematocrit tubes, are infrequently used in the laboratory setting, but may be used in physicians' offices. They are small plastic or glass tubes designed to hold 50 to 75 microliters of blood and are primarily used for manual hematocrit, also referred to as packed cell volume. Capillary tubes are available heparinized with red, green, or yellow bands, or without additive, plain or blue banded. Once the capillary tube is 3/4 full, seal the end of the tube not used for drawing up blood by gently inserting it into the clay-like sealant at a 90-degree angle to prevent loss of blood during centrifugation. Infant capillary collection, heel stick. Equipment needed for this procedure is as follows. This procedure is simulated for demonstration purposes.
Hello, I'm Lisa from the lab. Can you tell me baby's name?
This is Hannah.
Can you tell me
When
her date of
preparing
birth?
for an infant heel stick, introduce yourself to the parent. Obtain patient identification.
Thank you. The doctor ordered some blood work on her, and because of her size and everything, what I'm going to do is just go ahead and draw blood from your heel. Is that okay with you?
Yes.
What that wouldn't be
Inspect
first
the
because
infant's
it's the
heel
heel.
for any abnormalities and warm the area as needed.
We usually do the heel puncture on the bottom of the heel off to the sides of the foot. And that should work out really good for her.
Okay.
Assemble your supplies.
I'm going to go ahead and clean my hands first.
Sanitize your hands and don disposable gloves.
Go ahead and do the needle puncture.
Once the baby is positioned, clean the area with an alcohol pad and allow to dry.
I think she knows what I'm going to do.
Mm-hmm.
This is the puncture device. It would just make a little cut just on the
Hold
bottom
the
of
infant's
heel
foot
up to the
firmly
side.
but gently in a
And
vertical
let the
position,
blood continue.
clasping the top of the foot and exposing the heel. Raise the infant's foot and place the surface of the puncture device on either the medial or lateral border of the heel. Once the device has made complete contact with the heel, depress the trigger and allow the blade to retract. Use a dry, sterile piece of gauze to gently wipe away the first drop of blood. Taking care not to contact the skin, touch the collection device to the drop of blood and fill the container to the desired level.
Alrighty. We have all we need. And what I'm going to do is just have you hold the gauze on her foot.
Press a clean piece of gauze to the puncture site and ask the parent to hold it until bleeding has stopped. Label the specimen . Capillary collection on a finger. Equipment needed for this procedure is as follows. Introduce yourself. Perform proper patient identification. Explain the procedure to the patient, taking time to answer any questions. Perform hand hygiene and put on disposable gloves. Assemble the equipment you will need by determining the age of the patient and the tests that have been ordered. Select the third or fourth finger of the non-dominant hand if possible. Assess the patient's fingers. If they appear cyanotic or swollen, do not use. If the patient's fingers are cold, you may need to use a warming device, such as a warm wet washcloth or a commercially manufactured device. Ask the patient to hold the device in her hand for 3 to 5 minutes. Gently massage the finger near the puncture site to help increase blood flow, but do not massage vigorously or squeeze the finger, as this could cause hemolysis. Position the patient so that the hand can be held out comfortably. With the palmar surface up, grasp the finger firmly, holding it between your thumb and index finger. Clean the site with an alcohol pad and allow it to dry completely. Ensure that no residual alcohol remains on the site, as this could contaminate the specimen. Align the puncture device so that the cut is made across the fingerprint ridges to allow the blood to flow into a well-rounded drop. Push the button on the device to release the blade and wait 2 seconds before removing the device to ensure that the puncture has been made and the blade has been retracted. Immediately dispose of the puncture device in a hazardous container according to your facility's protocol. Wipe away the first drop of blood with a clean gauze pad. Do not use an alcohol pad, as this could contaminate the specimen. When you have established blood flow, take care not to constantly massage, milk, or squeeze the finger, which could prohibit blood flow and cause hemolysis. Constant massage may also cause tissue fluid backflow into the sample. Depending on the test being performed, collect the appropriate amount of blood into the specified container according to facility guidelines and manufacturer instructions. Once all collection tubes are filled, apply pressure to the puncture site using a clean piece of gauze. Ask the patient to assist if able. Once the bleeding stops, apply a bandage if needed. Thank the patient for her cooperation and answer any questions.
All right, one more, guys.
Hand collection using a winged infusion set. Equipment needed for this procedure is as follows. Introduce yourself and ensure that the patient is in a comfortable, safe position. Perform proper patient identification, explain the procedure, and answer any questions. Check your provider order or laboratory requisition to confirm the tests ordered. Perform hand hygiene. To check for a viable vein, apply the tourniquet on the forearm above the wrist. Choose the largest and straightest vein on the top of the hand. Assemble your equipment. Perform hand hygiene again and don disposable gloves. Cleanse the site with an alcohol pad and provide time for the skin to dry. Remove the winged infusion set, the syringe, and the blood transfer device from the packaging. Uncoil the tubing and attach the syringe. Discard all packaging. Ensure the patient's hand is resting comfortably. If necessary, provide a pillow or rolled towel for support under the wrist. Apply the tourniquet and tie it on the forearm above the wrist. Using your non-dominant hand, anchor the vein firmly below the insertion site, taking care not to flatten the vein. Grasp the needle between the thumb and index finger by folding the wings together in the middle. Insert the needle into the vein with the bevel facing upward and in the same direction as the vein. The insertion angle should be between 10 and 15 degrees, or less as needed. Once the needle enters the vein, you will see a flash or small amount of blood appear in the tubing. Never pull back on the plunger if you do not see the flash of blood. Make sure to thread the lumen of the needle into the vein until the bevel is no longer visible. Continue to hold the butterfly wings during the procedure and collect the sample with one hand to prevent the possibility of the needle coming out of the vein. Collect the specimen by holding the syringe vertically and using your thumb to gently push the plunger upward, allowing blood to be pulled into the syringe to the volume required. Slowly pull back on the plunger, matching the rate at which the blood is flowing into the syringe. When the collection is complete, release the tourniquet, remove the needle, and activate the needle safety device. Apply pressure to the site with sterile gauze. The patient may assist with this if she is able. Remove the syringe from the winged infusion set system and discard the tubing and needle into the biohazard sharps container. Attach a blood transfer device to the syringe to transfer the sample to the appropriate evacuated tubes in the proper order. Tilt the tube slightly so that the blood runs smoothly down the side of the tube rather than directly into the bottom, which could result in bubbling and damage to the red blood cells. Once the tube has filled, remove it and gently invert per manufacturer guidelines. Label all specimens according to healthcare facility protocol and invert the tube to mix. Check the patient to ensure that bleeding has stopped and apply a bandage if needed. Thank the patient for his or her cooperation and answer any questions.
Okay, guys. So this is what I would suggest. You can hear me now? Yes? Okay. This is what I would suggest you do, because we do have a quiz on Thursday on chapters 10 and 11. I would suggest, I'm going to upload this lecture that we did so that you can have and review any of those questions we went through. I would also suggest that you go to the end of chapter 10 and the end of chapter 11 and go through those certification exam preparation questions. The answers should be in your book, I believe. But go through them and make sure you know those. And if you do those two things, I think you'll be good for the quiz on Thursday. Okay, so we'll start with the quiz on Thursday, and then we'll move into chapters 12 and 13. And we're going to talk about special populations and blood collections. Okay, remember, no more late assignments. Make sure that you get your Kahoots in on time. And some of you are successfully uploading them in your Blackboard. I think that's how we're going to do it from now on, is go ahead and do it in your Blackboard. That works really well because I can grade it right there too.
How would we load like the Kahoots on Blackboard?
All right, Sam, tell us how. How are you doing that?
I'm sorry, what was it?
How are you getting your Kahoots on Blackboard? What are you doing to make that work?
I just go copy the code, do the Kahoot, and like I'll have a screenshot of the Kahoot once I'm done and upload it.
Upload it onto the Blackboard assignment. So you're going to open up the assignment on Blackboard, and then he puts the picture of it inside, right? Into that assignment.
Yep.
Yep, that's working really well. Also, don't forget, don't wait to the last minute, guys, to do those modules, because you've got one this week, module 4. So make sure you're getting those done on time. And the only other thing, so we've got 2 Kahoots this week, you've got your module, and then by next Tuesday, you'll have some test banks. So you might want to start working on those too, because next week, week 4, we'll have the second exam on 7 through 12, I think.
I tried to go in and look for the Kahoots earlier, not the Kahoots, but the test banks, and I couldn't find them.
Oh, okay. I might need to go upload this. Thank you for that. I'll go do that right now if they're not on there yet. That's good. I'm glad you told me that. Okay, so I'll take care of that. I will see you guys on Thursday. We'll start with that quiz. But like I said, go to those questions at the end of each chapter, and then I'll upload this video to Blackboard. So if you want to look at it again. All right, any questions? All right, I'll see you guys Thursday.